Okay, your patient is suspected of having hepatitis C virus. Maybe LFTs are abnormal and the antibody is positive. First thing you should do is confirm the diagnosis by showing the patient has a positive viral load. Remember, 10 to 15% of patients will clear the virus on their own and be left with a positive antibody. The other viral characteristic you need is the genotype. This is going to help you determine which treatment to use and the duration of treatment. There are two important concepts that you have to think about next. First is staging of the disease, and second is whether treatment is indicated. Remember, after infection, the average person progresses from one stage to the next, up to stage 4, which is cirrhosis, every 5 to 7 years. So if they've had the disease for 25, 30 or more years, they have a high risk for cirrhosis. You can try to stage non-invasively with a serologic fibrosis panel or an ultrasound method called FibroScan. These are very good at telling you if the patient has minimal disease or cirrhosis, but are not likely to help you determine the intermediate strata. And if this fails, you have to resort to liver biopsy. The second issue that you have to discuss with the patient is whether treatment is indicated. Remember, you don't have to start treatment until the patient has at least stage 2 fibrosis. They can be treated if they're a cirrhotic, but not a decompensated cirrhotic. Remember, the negative predictors for sustained virologic response include race, genotype, insulin resistance, kidney disease, and cirrhosis. You should also know the side effects of treatment. It includes flu-like illness, depression, unmasking of autoimmune disorders, cytopenias. Lastly, what are some of the things that you should think about in all Hep C patients? Always check for hepatitis A and hepatitis B serologies and immunize the patient if negative. Furthermore, check HIV status. Counsel the patient to avoid alcohol as it acts synergistically with the virus to speed up the process of fibrosis. Tylenol is okay. And counsel the patient on how not to spread this to other people. No sharing of razors, toothbrushes, and of course needles. Hope this helps. Good luck treating your patient.